There we go. Again, thank you for joining us today. Our topic of discussion today and the presentation is better hearing can equal less stress. So we're going to discuss a little bit about how you can achieve that and why living with hearing loss can present stress to our lives. This is sponsored by Sound Hearing Care, and I'm Dr. Susan Bondt, and Jennifer Waddell, who is the hearing instrument specialist and owner of Sound Hearing Care, is with us today. Hi, Jennifer.
Hello.
So she and I are going to be kind of walking you through some, I think, really valuable information if you live with hearing loss or live with someone who has hearing loss, just to understand a little bit more about the fact that you're not alone if you're experiencing that, and the kind of impact that it has on our overall health and well-being, and particularly the kind of impact that can have on our own kind of brain fitness. So I'll be doing kind of most of the kind of guide through the presentation today, but Jennifer's going to jump in with tidbits and kind of her take and how she approaches some of these difficulties. So first, we're going to talk a little bit about how common is hearing loss and kind of what are the effects of hearing loss, most of which I'm sure will be familiar to you. By the way, I almost forgot, we have Fane Fisher with us today from Widex, and she's doing us the favor of kind of monitoring the chat. So if you do have any questions, you should, at the bottom of your screen, have a little chat button. And I just invite you, if you want to type in a question, she'll kind of be taking questions from the group, and then she'll share with us questions. If they aren't answered, right away in the presentation, she'll make sure that those questions get to us. So there are over 48 million Americans, that's about 20% of the US population, that have some degree of measurable hearing loss. And as you can expect, as we get older, we're more likely to have some hearing loss, mainly because we've lived a few more years, we've maybe been exposed to more potential loud sound environments over time, and then quite often we may have other health or medical kinds of issues that can have related hearing loss as well. So for those of us 65 and older, over 40% of that age group does demonstrate some hearing loss. So again, if this is something either you're just beginning to notice at any age, or if you have family members or friends that are dealing with this, it's a very common problem. So how do we know that we have hearing loss? What are kind of the warning signs? So either you or your family members or friends, because sometimes the people around us notice it before we do. If it happens very slowly, we don't notice those changes. But the most common kinds of complaints, even with just the beginning of hearing loss, is, well, I can hear, but I just, I can't understand. Often people, when they're in noisy environments, particularly like in a restaurant, large groups, places of worship, maybe where you're trying to hear a voice that's at a distance, but you've got people that are talking a bit all around you, you start to have that difficulty in being able to get each word clearly. So you do find that you're missing things here and there and maybe having to guess to kind of fill in the blanks. And quite often our initial response, of course, is to ask people to repeat or turn to the person next to us and say, what did they say? So these kind of things, if they're starting to happen, again, even with mild hearing loss, can begin to be noticeable. As hearing loss may progress, you may find that you're having to look more directly at people to understand them. I always notice that if I take my glasses off and I'm trying to talk to someone kind of across the room, I don't seem to hear as well. So we know that we depend on our eyes as much as our ears for hearing. So we look at the face for expression, some lip reading, which we naturally learn how to do. So if you find that you're depending more and more on being able to see the speaker's face to have that easy conversation, it could be that your eyes are taking over for a little bit of decrease of input coming in through your ears. And then, of course, if you find that you're turning the volume of the TV or the radio up a little bit louder and louder and louder, if you see the numbers kind of going up, or if you have family members that tell you, gee, I can hear the TV before I walk in the front door. Again, those are usually kind of gradual signs that we're compensating for not hearing so well. So certainly if you find that you're surrounded by a lot of mumblers, that people don't speak as clearly as they used to, indeed, there are some people that speak either very softly or don't enunciate well. But if you find it's kind of more common than not, that it seems people aren't speaking clearly, part of it may be that you're not hearing quite as clearly as you once did. Now, as we get older, obviously the possibility of having more loss becomes greater. And in fact, we know that at age 70 or older, about 2/3 of people will have some degree of hearing loss. And from the kind of neurologic studies that have been done across the last couple of decades, we've really tracked and come to understand that living with hearing loss, particularly if it's not treated, puts extra strain and effort on our brain, because we have to kind of, again, fill in the missing pieces in order to have those conversations and understand with ease. And this extra effort actually taxes the brain. So even with a mild amount of hearing loss, if you've lived with it for several years, we know that it can be equal to aging your brain by about 7 years. A mild loss will equal about a 7-year decline in cognitive or brain function. So that would be speed of the way that you understand things, short-term memory can be affected. So it's that extra stress, because we're talking about how hearing loss can cause stress, that extra stress on your brain to compensate for what it's not taking in through your auditory sense. As we get older, obviously our brain is more compromised anyway, even with normal hearing, but those with hearing loss also have a higher risk by about 24% of increased cognitive difficulties or brain function difficulties. And many of these things can cause us to kind of pull back from participating in conversational situations. So we tend to become more isolated. We know the fact and the event of becoming more isolated, not having those social contacts and interchanges, also has a potential for causing higher cognitive brain functioning impact. So this can be kind of multifaceted, and starting with even just I'm not hearing as well as I used to, and a whole variety of things that can kind of cascade in and cause our brain to be under greater stress. Usually one of the first things that people do complain about, and this is even with very mild loss, is that, you know, once I walk into the restaurant, I can't hear that voice against all of the other voices. Or if I'm outside and it's you know, super noisy, there's traffic noise, any other kind of competing background noise, quite often that will cause more difficulty just following conversationally. So even if you have pretty good hearing, if you are over that age of 70, we know that those individuals are going to need the speech or the conversation to be about 3 to 5 dB louder above the noise as compared to, say, a young listener, where the noise and the speech can be more equal. But for those of us who are a little bit older, we need that voice to be a little bit louder than the background of sound. And that's, again, even with very mild loss. Also, with mild loss, we know that as our brain gets a little bit older, it naturally needs more information to kind of accurately understand that conversation against the background noise. And we know that just because of the normal aging process of our brain slows down a little bit. It takes a little bit longer to retrieve from memory. I know we've all experienced that to some degree. But these cognitive difficulties are going to be more pronounced when I'm trying to listen in conditions that are really challenging. So if you couple these kind of natural aging effects on the brain with even some mild hearing loss or more moderate to severe loss, then obviously the effects of aging on the brain and hearing loss increase that stress that we understand. I want to give you just a little bit of an exercise to do. So I want to just kind of explain how that living with hearing loss does make your brain work harder. So remember, the brain actually does a pretty good job. It can identify sounds, and it can differentiate what's a voice and what's noise. Does a pretty good job with that in most cases. It needs kind of a complete sound picture to do that easily and to understand the conversation easily. But it's pretty good at kind of filling in automatically a lot of that missing information. But the bottom line is it has to be able to understand the sounds that it's receiving. And obviously that's where hearing loss comes in. Those sounds then begin to be distorted or incomplete. And then the brain has to work harder and harder. What the brain tries to do is to filter out the background and focus on the conversation, focus on that voice that's right in front of us. But these are efforts and tasks that take energy and concentration and focus. So we're going to do a quick little exercise. So for those of you that are participating with us today, I'm going to have you on the next screen. I want you to say the colors of the dots, and I want you to say them out loud and say them as fast as you can, reading the colors from left to right. Okay, so here's the first task. I should have Jennifer and Fane do this for us too. But I'm sure if you found this a very easy task, red, blue, green, yellow, right? Pretty quick, pretty easy. Okay, the next task. I want you to say the colors in which the words are printed on this next screen. And again, if you will, say them out loud, say them as quick as you can, going from left to right. Ready? Here we go. Now, you probably still did pretty good here, but now, your brain had to actually fight the urge to say the word hard when over. It really wanted to say, it was reading those words, but your brain knew the instruction was don't say the word, but say the color in which the word was printed. So again, you had to kind of do two levels of tasks to say green, red, white, and blue. We're going to do one more. Again, say the colors in which the words are printed, fast as you can, out loud, and just read them again from right to left, the colors in which the words are printed. So what begins to happen here, now we've actually got 3 steps of processing. So I'm taxing your brain. And what happens is the time it takes to say, not the word red, but the color green, blue, this is even hard for me to do as I look at it, white and red instead of black. It takes time for that processing because my brain is having to go through several steps. It's this extra effort, just to give you a little bit of an idea. If you can imagine, this is kind of like what it's like to live with hearing loss and be in all of your day-to-day situations. And for your brain always have to be multitasking to kind of sort out the background, find the voice, understand the voice, and you may even struggle with understanding clearly. So your brain's having to fill in the gaps. All of that is stressful, requires extra energy, and again, extra focus and concentration. So what we find over time is that the evidence that you have this kind of auditory stress, because as you remember, we hear with our ear, but we understand with our brain, is that you may begin to kind of give up some of the, what were once very enjoyable kind of situations, activities like maybe going to church, going to prayer meetings, going to the movies, going to book club or bridge club, because it takes so much energy and effort to hear in those situations. You may attend for a little while, but come home just exhausted. You might find you're good for 20 or 30 minutes, but there's no way you're going to stay for 2 hours in those situations. So those are some of the signs that your brain is under this kind of stress. So you end up kind of retreating and stop going to these events, which typically you would have really enjoyed. And this again kind of leads to that gradual isolation where you're not getting the enjoyment and the pleasure and stimulation from social interaction. The other thing you might notice is that you're struggling to hear on the phone. That's typically one of the first things that people begin to notice as their hearing becomes moving away from normal to mild and mild to moderate. So you may find that you have long conversations are out on the phone, even though you might really enjoy talking to family members, grandkids, that type of thing, but it's too difficult. So you'll tend to kind of stay away from long conversations. You might even stop answering the phone altogether. So just remember, this kind of stress, even the beginning and mild stages of hearing loss, can age your brain before it's time. And if you live with some even mild loss for a few years, your brain eventually may be aging to the point where it's about 7 years older. So I just want to take a quick moment to see if Jennifer or if Fane have any questions for us or anything they want to add.
I do. We did get a question when do most people replace their hearing aids? As this one would be a really good one to discuss. I mean, to the point where if they're people who've had hearing aids before, when do you think would be a good time to make a change?
Good. And Jennifer, do you want to kind of, what do you typically share with your?
Usually people will start looking every 4 to 6 years. I mean, depending on the person, the severity of the loss, how well they've taken care of their hearing aids, the current state of technology. In the past couple of years, it's been a huge jump in technology. So we now have rechargeable, Bluetooth, so many different facets, apps on their phones, you name it, they have it now. So typically every 4 to 6 years, I would say. Some people push it 3, but I don't think that's necessary. Usually if you're in the ballpark of 4 to 6, it's time to start looking.
Yeah, that makes sense. You know, and from the technology perspective, within that period of time, your hearing may have changed enough and there may be new features and technology that would help you even better. And I'm so glad that you asked that particular question, whomever asked that from the group, because, you know, I've been talking about people with mild loss, but people with moderate loss that are currently wearing hearing aids may experience some of this same stress. And maybe it's because the technology that they have isn't doing all that it could to kind of take over some of the work and effort. So if you've had hearing aids that are 5 years or older, it's probably worth kind of getting your hearing reevaluated, have the hearing aids reevaluated. And in respect to those situations that you're really having difficulty, is there anything better that can help in those situations?
That can really make a difference in your cognitive skills. And it's kind of like going from beta to Blu-ray.
Yeah, exactly. Yeah, from like standard to TV, HD TV, you know.
Exactly.
The clarity, the signal, real natural.
Yeah. Exactly.
Yeah. And I know I was just discussing with Jennifer, because I know she's also just moving into using some cognitive evaluation methods, which are proven and have evidence to show kind of the relationship that hearing better can help to improve some of your cognitive functions. So she's also adding some capabilities of being able to evaluate and kind of monitor that, which puts her right at the forefront of
Pretty exciting. I can actually test your brain before getting new hearing aids and then test your brain again 90 days out, and it will increase your scores dramatically. It's pretty fascinating what we have available now.
Yeah, and believe me, not everyone has that. So I'm very pleased to see she's a pioneer. Let's talk just real briefly about the audiogram. Some of you, I'm sure, have had your hearing tested. Others of you maybe have not. So I want to give you a little bit of an idea of how do we determine, you know, where you stand hearing-wise. And of course, we do that by having you listen for a variety of different pitches of sounds, kind of like from bass tones to treble tones. And typically we look at how loud do we need to make that sound before you can just begin to hear it. And that's how we record your audiogram. When we're talking about the audiogram, what's most important to us is, of course, conversation, speech. And of course, we know that's made up of vowels and consonant sounds. And the vowel sounds kind of carry the loudness or intensity, but the consonant sounds carry the information. So hearing those consonants well is what enables us to hear conversationally with ease, because we get all of that information. There are other sounds that are important to hear. So it's not just about speech, because our hearing is what kind of relates us to the world around us. It's a 24/7 sense. It never shuts off, in other words, and it overall quality of life, because you're obviously listening to music, hearing outdoor sounds, the wind in the trees, birds, rain as it falls on your roof, how the car sounds. You know, sometimes we don't know there's a problem with the engine until we hear the car. And so hearing all of those sounds are important. So we're prioritizing kind of how you hear speech. Now, in most cases, this is the kind of hearing test result that we often get, very common. This person hears the bass tones very well because they're at the top of the graph. But when we move into the more treble tones on the right-hand side, we're having to turn them louder and louder. And this person is beginning to not hear quite all of the consonants, like the S's and the F and the T and the P. So they're struggling a little bit with understanding. As we go along, the hearing loss may progress. So now I'm really not getting any of the consonants. My hearing is much worse than many of those soft speech sounds. I really need some help to kind of regain and recover those speech sounds. I hear the voice because I hear the vowel sounds, but I don't understand. This is typically the complaint when we get to this part. And over time, we may find that our hearing drops down to the point where even the vowel sounds are difficult to hear. And this is the individual that needs to really be looking at you. They need to be close to you, so the voice volume is close by. And in this case, you know, we really need help in hearing not only the consonants, but the vowel sounds too for voice volume. So as we kind of go from a mild to a moderate to a more severe hearing loss, we need more help in just recovering these speech sounds for conversational ease in listening. So how do we do that? Once we've identified that there's some hearing loss there, obviously we want to see, is there some technology that's going to help, you know, recover those sounds for us? And certainly we know in the past 20 years, all of these, both TV, telephone, the VHS, the beta version of the VHS, even the cassette decks, the VCR recorder, all of those things, basically now we have that technology that can fit into the palm of our hand, both with our smartphone, which is like having a computer in your phone, of course, and the use of hearing instruments, hearing aids that can be linked and communicate with that smartphone. So we've come a long, long way. And I want to take just a minute to kind of describe to you how Widex approaches helping you to recover or regain access to those sounds. And the current family of products in the Widex family is called the Moment. So we're going to talk a little bit about the Moment and how it is helpful for any degree of hearing loss. In the Moment family, there's a variety of different styles. There's both in the ear customs, and there are the very, very popular tiny, what we call receiver in the canal, which has a tiny little piece that's behind your ear and connected to an almost invisible wire that tucks down in your ear. So these are the most popular styles. I think primarily because cosmetically you can't see them. That little wire is, again, almost invisible. Everything else is hidden. So there's a cosmetic appeal, but they're also very comfortable and very easy to get used to. So that's typically what we're fitting these days, but we have all different styles available. What all of them have in common in the Moment is the ability for the technology to recognize the kind of listening situation that you're in and adjust automatically. So I often tell my patients that really, I only want you to have to remember 2 things day to day about your hearing aids, and that's to put them in the morning when you get up, get ready to head out the door, and to take them off at the end of the day before you go to bed. Really, during the day, as you get in the car, you get out of the car, go into the grocery store, stop in at the doctor's office, maybe take that walk outside. As you move throughout your day, we want the technology, the hearing aids, to adapt to your environment so you're not having to think about it. And with the technology that we have today, and particularly in the moment, it's very sensitive to what's going on in your environment, and it recognizes when there's a voice that's close by or a voice at a distance from any direction. It recognizes automatically when music is playing and kind of shifts to better sound quality from music. It recognizes when there's background noise, and it separates the conversation from the noise. It enhances the conversation so it stands out better and easier for you to understand against the background noise. So all of these things can be done automatically so that it's doing the hard work and you get to just relax and enjoy your day. The second thing that's most important, and that the Widex Moment has, it's important for all situations, but it's natural sound quality. And the Widex Moment does have a specific processing program called Pure Sound. And Pure Sound allows us to give you kind of the most natural kind of sound quality possible. It is kind of based and related to certain degrees of hearing loss. So even if you don't have a pure sound type of loss, you're still going to get the benefit of good sound quality, high fidelity, and automatic, easy functioning. But if your hearing loss is in the range for pure sound, you'll have even more of a kind of natural, transparent kind of sound coming through the hearing aid. When we give people a chance to kind of explore and experience pure sound, these were some of the most common kind of descriptors. They tell us that it's clearer, it sounds more natural, my own voice sounds better, sounds more normal. It seems to be kind of a more pleasant, calmer sound, and I'm hearing better and understanding better. So I would encourage you to ask Jennifer when you come in to get a hearing test if you are a candidate for pure sound, because in the Widex Moment, it really gives you the most natural kind of transparent sound that you've ever experienced through a hearing aid.
I just have another question coming from the audience. Tell me what makes Widex different than other brands of hearing aids that also may have some claims that they have good sound as well. What makes
Widex has been known, for instance, as kind of being the musician's hearing aid for a long time. And not only in the current Moment family of products, but even going back to several platforms or chips from previous products. And it's really a couple of things. Widex is able to measure sounds coming from your environment from the very, very softest to the very loudest, to measure those sounds without introducing any distortion. Once a hearing aid measures the sounds, it then begins to process them to kind of meet the needs of your hearing loss. But if a hearing aid introduces distortion at that measurement stage, a distortion is going to be present at the other end. It's kind of like garbage in, garbage out. So Widex has been known for having kind of the widest sound window that gives us the highest fidelity of sound to be processed for your particular hearing needs. So there's that. And then Widex makes a priority of the very softest sounds in your environment, because we know those consonant sounds like the S, the F, the T, and the P basically are the softest sounds in speech, but they're the most important sounds to hear. So those 2 things and some other kind of technology approaches and features focus on preserving the characteristics of speech, even when you are in background noise, not only preserving, but enhancing those characteristics of speech. So that kind of gives Widex its well-known high fidelity kind of sound. But then in the moment, we've taken that a step further with a new algorithm and this new pure sound processing pathway. Excellent question. Any other questions? Okay. In addition to the automatic functionality of your Moment hearing aids, there are times when you might like having a little bit of control on your own. And as I mentioned, our smartphones, whether they're Apple products or Android platforms, have the ability to use the Moment app, which gives you so much control right at your fingertips, changing the volume, changing or choosing between different programs, kind of changing the directional sensitivity so that it's paying attention to the direction that you're looking. Or maybe you're in the car and you want to be able to hear in the back seat, so you can kind of change that directional sound sensitivity to behind you. So the app is not necessary. Many people don't use an app because the hearing aid does a pretty good job on its own. But for those of you that would like to have that little bit of extra control to kind of dial in your preferences, the Moment app is available and easy to use, and gives you that control that you might be looking for. So why does better hearing matter? Obviously, we want you to hear better. We want your brain to have more information so it doesn't have to work as hard. We want to be able to decrease the stress, and technology can help us to accomplish that. So I'm going to wrap up with just kind of some reasons that if you have hearing aids, but you feel like you're not hearing as well as you'd like to, maybe you're still struggling in certain situations, or maybe you haven't had, your hearing tested in a very long time, and you're not sure, whether there's enough loss there to take a look at getting some help. Here are just a few reasons that I want you to kind of have in mind. Remember that we want to improve your hearing for just hearing the whole environment of sound around you. Obviously, there are some safety and awareness kind of reasons. If you're walking down the sidewalk on a busy street, I want you to be aware if a car is passing, or if there's a bicyclist coming and they're ringing the bell, so that they don't surprise you when they're right beside you. Being aware of the environment around you, we take a lot in from the sound environment for that safety and awareness. Obviously, we want to make sure you stay connected to those that you enjoy being with, because we know staying engaged in those social situations is very important for our overall mental health as well as physical wellness. We want to improve your ability to hear conversations, particularly in challenging listening environments, and say maybe even over the phone, because that helps you stay active, to keep learning, to stay independent, not have to depend on anyone else to be your ears for you. And most importantly, because we want to be able to reduce the stress that happens to our brain when the listening effort is intense, when it's really challenging. Because if we can take that stress off of your brain, it's going to help keep your brain fit. It'll perform better. It'll perform more quickly. And we want to prolong that fitness of our brain's ability for as long as we possibly can. So what are the steps to better hearing? Well, actually, you can check off number one. The first step is just to get educated, understand more about your own hearing, the difficulties of hearing loss, and what maybe some of the available options are. So participating today hopefully has given you some more information and food for thought. The second step is, of course, to find a professional, and Jennifer at Sound Hearing Care is knowledgeable. She's obviously caring. Her patients stay with her for a very long time, very loyal. And she stays on top of what is state of art in technology. As we mentioned before, she's kind of leading the pack with moving into some cognitive evaluation as well as hearing evaluation. And it does take a real commitment to stay on top of hearing technology, because as she mentioned, it changes pretty quickly these days. So staying knowledgeable about the technology that you might have and what can be done to really maximize and optimize your benefit from that technology is very important. And last but not least is, of course, if you haven't had your hearing tested in a while or ever, Or if it's been tested, but maybe it's been more than a year ago, or you notice that you're not doing as well as you were, maybe even 6 months ago, schedule an appointment to have that hearing test updated, or at least get a baseline audiogram. And she can also let you listen to new technology if you're just kind of curious as to whether or not it might be of benefit, and help ease your listening efforts so you can get back out and enjoy those situations again.
Yeah, we have the 2-week sound challenge here. So we let you do a 2-week sound challenge to see how your old hearing aids compare to the new, as well as if you've never worn hearing aids. Gives you a great option. So that's low pressure. You don't feel like you have to invest thousands of dollars just to see how you're going to hear with the new technology, which is really
that's excellent. That's a great opportunity.
Yeah.
Yep.
And one more, can I just ask you one more thing? Can you just address ringing in the ears? We did have a question about ringing in the ears, and how helpful, how can aids help with the ringing in the ears?
Well, Jennifer, do you want to, I know you have a particular approach to that as
right. Well, I've learned from all the experts, University of Iowa. I've done all the training. I'm certified in tinnitus care. Essentially, most of the time, 90% of the time, your hearing loss is what's causing the ringing of the ears. As we remember, ears pick up the signal, brain's what's hearing. So the brain's not getting a clear signal. There's essentially a pothole in the pathway. So the car can't get to the destination. So the brain says, I need those frequencies that are missing. So I'm going to play what's missing in the brain. And so typically when you treat the hearing loss, it will definitely calm down the ringing in most circumstances. But again, Widex, the new Moment, as well as some of the other technologies that they have the ability to help with the ringing. So they have what they call Zen, which retrains the brain how to block out the ringing. So it's a really nice combo. 60% just need the hearing aids, 40% need the Zen therapy.
Need a little extra help.
Habituation. Yeah. So it's a wonderful product, and it saves a lot of people from the trauma. And I have the ringing, and it can drive you crazy, literally. So it's a wonderful, wonderful technology. And I suggest if you do have ringing ears, come see me. I hopefully can help you, because I understand. I feel your pain.
Yeah. Well, again, if there are any other questions where you have time to answer, just encourage you to reach out. We've got Jennifer's office number here, 864-881-1663, or you can go to her website at www.soundhearingnow.com, and there's a little button that lets you schedule or request an appointment right on that site as well.
Also too, if you have hearing aids and you're ready to make an upgrade, we're doing trade-ins. So I would love to talk to any of you who are interested in trying the new products. We can let you try them for a couple weeks, and then if you are interested, we can do a trade-in with what you have existing.
Great. Can't beat that.
And promos for those that have never been in before. So it's a great time of the year. Thanksgiving's coming up. The holidays are coming up. I know COVID is a concern, but you're still going to have to put up with that crazy old uncle. So, so hearing aids can really help.
Definitely so. And, maybe Jennifer, just address, if people do have concerns about COVID, what special kind of precautions do you take?
Oh, well, we treat the office. We do temperature checks. We have masks. We aren't doing the sound booth right now with the COVID. So we are doing in-ear testing with soundproofing, and just trying to do all the safety measures. All of the folks that are seniors that are coming in for clean and checks and so forth can stay in my parking lot. We're trying to do everything humanly possible to keep everybody safe, but also maintain your hearing, because your brain is important and your hearing is important.
Yeah, particularly during these times. And,
right.
And it kind of brings up a lot of people, even with just a little bit of hearing loss, are struggling because now we're all trying to communicate with a mask on, and that
exactly.
That takes the speech sounds, dampens them down. So
10 to 15 dB. So that's a lot.
That is a lot. And I know we have at Widex, we have kind of ways, either through the app or through the programming and the hearing aid, that we can give you kind of a special program for when you're like at the doctor's appointment, you're trying to understand that important information with the nurse or the doctor wearing a mask. So we have ways that we can kind of assist with that, with the technology.
Correct.
Okay, well, if there are no more questions, we'll wrap it up. Thank you for participating today. And please reach out at the phone number that you see on your screen or at that website. Again, there's a request an appointment button right there on the front screen. And we'll hope you take advantage of the opportunity to work with Jennifer.
I hope you do.
All right, thanks everybody.
Thanks for your time, everybody. Have a blessed day.
Have a great day.